Hello, it's Rafael Gutierrez, and welcome to our channel. Now, today I'm going to actually talk about something called the bubishi points. And these are points where the bubishi talked about could cause a lot of damage in a person, either disabling them or killing. And I actually started looking at these points, and I did see something pretty interesting. One of the first things I saw, and I have it in my book, Breaking Points, is there was a picture that used to be part of a lot of the medical textbooks in old Germany. We call it the wound man, and I'll put it up here so you can see. It actually showed you all the points that medicine back then was worried about. Battlefield medicine was worried about where people got hit. Now, some of these were actually harder than others. And if you notice, a lot of these things are actually using knives and other weapons. Interesting thing is, if you actually look at that, you can find a lot of the same points that were in the bubishi, meaning that medical personnel in both Asia and Europe at the time were finding that some of these points were lethal, whether in both places, meaning that there probably is something to that. Now, we can't just say that. What we can say is, we can't say that for some reason people in the past found certain points that were required medical intervention afterwards. And what I'm going to do is I'm going to actually do this 2 points at a time. And the first 2 points I'm actually going to talk about are in the head. And one thing to know is that any head trauma, no matter how minimal it seems, is something that should be evaluated. You don't want to play around with head trauma. You don't want to have someone die on you because you didn't realize that they ruptured an artery, and they're saying, "Oh, well, I just feel a little dizzy." You can die from something like that. But what I'm actually going to do is instead of actually trying these out, because well, obviously there'd be ethical considerations, I'm going to use a scientific method, as Descartes gave us. Now, Descartes gave us a scientific method of 4 steps. You have an observation. In our case, it would be in China and Okinawa, they had the bubishi, which was used to determine where to hit to cause the most amount of damage. And Europe has a similar thing for medicine as well, showing where a lot of places that get hit or struck by anything may end up leading to needing medical treatment. So that's our observation. Our hypothesis is these two things seem to overlap. And so there probably is some reason why these things would work for, be strike points which would cause medical need for medical intervention or would cause death. So to test it, though, rather than actually go in and hitting people in these points to see if they kills them, what I'm going to do is I'm going to use medical data and try to reconstruct the injuries that would come out from this. And so that's going to be the test I'm going to use. Now, if I find information that seems that there is a difference, then my theory has to be, it looks like these points do work. But what I'm actually trying to do is not try to prove that they work. I'm actually trying to disprove them. And based on trying to disprove them, that they work, I'm actually going to show you the theory that I came about. Now, the first 2 points we actually found is one was if you were to divide the skull in the front here, it's actually right in the middle of that line. The other one, if we were supposed to divide the skull in a line down the middle this way, it would be right here. Interesting thing is the skull actually has an anatomical sites here. So I'm going to use Martini's book to show you one picture. It's here. If you look at it, this would be the front, and here this would be the back. This area here is where the first point is, right here, where these 2 lines cross. These 2 lines are suture lines, and they are supposed to be the areas of the skull that are most likely to break. And the other one is up here, which is again in between a suture. So the question is, the first thing we actually see is there an anatomical reason why those things would be good points? And the answer is yes, those are areas where the skull would break. Now, the truth is, though, I will tell you, I've broken into a lot of skulls. I teach anatomy, and so I've had to go. When I've done it, I've needed a chisel and hammer. And when I did that, yes, I was able to get into a skull. It did take force to break the sutures. It didn't always break the sutures perfect. Sometimes it went to the other sides. But yes, the sutures are used for breaking, but they still require a lot of force. So sometimes I wonder if these two were actually done using weapons. Now, I also did something else, and you can do this too. They sell these little men for art. What I did is I drew some eyes so I know where the front is always. And I also drew the suture line. So if you think about it, the suture line here in the middle is one point, the other one is over here. And so these 2 lines, yes, they can potentially break. But so what? People break arms all the time. Why would breaking the skull be so much different? And the reason is just underneath the skull you have a protective layer over the brain. And in that area you have a specialized vein, which is called the superior sagittal sinus. It's actually a huge vein that you can see there. And what I found looking at this is whenever those two areas were broken, that vein ended up getting torn. When that vein got torn, it ended up forming a hematoma, which put pressure on the brain. Now, today with surgery, we can take this person, watch them, or if it gets too bad, we can go in and people can go in and operate and fix the leak. But back in the time when we didn't have necessarily that understanding of surgery, you would end up having those breaks, and eventually the person would die, probably in a couple of weeks, maybe in a couple of weeks. Sometimes, depending on how fast it's bleeding, it could be a couple hours, maybe even, maybe even depending on how bad and what was happening, a couple of seconds. And so these two potential breaks. Well, because of the fact that you're forming a hematoma and you can end up causing brain damage, they do fall into both causing functional and structural damage, which would not allow the person to work right, and what can also lead to death. So these 2 points probably would actually be relatively effective. Are they always used? Well, that's something we have to deal with later. Hello, just to show where the 2 points would be, I now have a skull, and if we turn it around here, you can see the sagittal suture here. Point 1 would be around here, point 2 would be here, and what you're talking about is the emergency would actually happen if this broke. Now, like I said, when I had to break one, I actually used a chisel and hammer. But if it breaks here or here, a lot of times you break the underlying structure. Now, I have the brain here, and between the brain here, you have a special venous system called the superior sagittal sinus. And if this tears, you end up having a lot of pressure and a lot of bleeding, which can end up leading to death. Now, one of the problems that I see with this is when I did look at the case studies, I found that most case studies were looking at in a year period, they were only getting about 15 cases of that fracture. Usually they were from severe trauma. So as a self-defense case, it probably wouldn't be that important. What it wouldn't be important is if you were dealing with some sort of weapons, or if you were actually trying to heal someone. As a fracture there, you may be able to do some work to fix it. I don't know if back then, when the bubishi was originally made, it may just be to let the family know, hey, you may want to say your goodbyes. But again, for self-defense, as you have to break this, and the injury happens so rarely, as you have to break the the suture here, and it happens so rarely, chances are, for self-defense, wouldn't be a good point, but it doesn't mean it's not effective. It just means that it would have to be done with some sort of weapon. I hope you enjoy this, and have a nice day.